And welcome everyone. Appreciate your coming tonight. I have no financial disclosures, and the objectives, learning objectives for this CME activity include identifying associations between indoor and outdoor air pollution and neurologic disease, explaining the health benefits of building electrification, and outlining how clinicians can counsel patients on primary and secondary prevention of neurologic diseases from air pollution. I'm going to shoot for a little bit more detailed talk tonight because this is a CME activity and many of the people here are clinicians, but this should be a very good overview for the broad audience of people attending. And thanks again for coming. Just as a spoiler alert, I'm going to be explaining that moving to electric appliances, cooking, space, and water heating do protect health by improving air quality, reducing planet warming greenhouse gases, so we're also mitigating climate change, and reducing the high air pollution burden of vulnerable groups and vulnerable communities. So the San Francisco Bay Area often looks like a very clear air, especially if you're in San Francisco, because there's a lot of air movement and so forth. But actually the region, according to the American Lung Association State of the Air report this year, is still the 6th worst in terms of annual soot. Soot is PM 2.5, a particulate matter that's quite small in this. So compared to other locations in the country, and this is the annual exposure. And vulnerable communities and people suffer more due to worse air and health problems due to the proximity to refineries, industry, major roads, and lack of air filtration. And other sources that communities are experiencing in people in this region are other transportation, like airplanes, ships, and so forth, building emissions, agriculture, and wildfire emissions, all are adding together to pollute our air, including our outdoor air. And methane, which is called natural, when it's burned for building water heaters and furnaces, is actually responsible for more nitrogen dioxide or NOx, I should say nitrogen oxide or NOx pollution than all the passenger vehicles in the Bay Area. So air pollution and health is somewhat of a there are many aspects to it, and trying to just sort of give a sense. Burning of fossil fuels is the major pollutant that we're seeing that's pushing climate change and air pollution effects. And so air pollution is causing both greenhouse gases. Excuse me, I'm also plugging in my computer for it stays going. And it's causing toxic exposures through the direct air pollution emissions themselves. Greenhouse gases driving climate change cause other health effects, but the toxic ones we're going to focus on tonight. And there are multiple components like PM 2.5 or particulate matters, that's soot, and larger particulates that are 3 to 4 times larger, or greater than that, and nitrogen oxides, sulfur oxides, ozone, and also volatile compounds like benzene and formaldehyde, metals, and others. So we also are seeing a new air pollutant. It's not from burning fossil fuels, but created by fossil fuels, and that's microplastics, which may be also adding to the particulate burden that we experience. So PM 2.5 is defined as less than 2.5 microns, and these are on the order of a thousandth of a millimeter. The largest of these are about a 30th of a human hair, to give you a scale, or some grains of sand. And the PM10 larger, 3 or 4 times or more. And these particles actually can be as small as a thousandth of those large particle scale, or a thousandth of the micrometers. And those run in the range of what we call ultrafine particles. Um, the mechanism for how this might affect us is not fully understood, but we know that there are probably inflammatory and oxidation reactions going on at the surface of the deepest lung, the alveoli, which could be one of the effects. And the smaller ultrafine particles are probably being absorbed. They're very hard to measure in the body, but we are seeing effects which are at specific organs. The air pollution is causing much health and even much loss of life worldwide and in the U.S. It's estimated that in the U.S., greater than 100,000 people die every year, and on the worldwide scale, over 4 million. And that's just the outdoor air pollution. 7 million premature annual deaths when you combine that with indoor air pollution. And in other countries, indoor air pollution can be more severe than here, but we are also experiencing significant health risk. This 7 million is greater than the annual deaths from diabetes and the total deaths from COVID. About half of this is due to stroke and heart attack and heart disease. And the World Health Organization states that at least or close to 99% of the world is experiencing unhealthy air. The outdoor air pollution, we talk about air quality index, and what is that? That's actually one of the toxins in the air pollution, and there are several that have air quality indexes. So for nitrogen dioxide, there's an air quality index, but when we talk about it on the news, it's the PM 2.5 index, and that index has an upper annual limit of the EPA is about 50 on the air quality index. The index is actually a short-term measure that we're seeing on a daily basis. And they're actually saying that a 50 is good, but on the annual level, 50 is not so good. That's a limit. So we're actually seeing health effects in the lower part or in the green part even. So there are really no safe lower limits, and that's why World Health Organization is more stringent, and they'll say 28 or 5 micrograms instead of 9 micrograms. So it's kind of a linear scale between micrograms per cubic meter air quality. When we're talking about indoor air health effects, we are depending on the body of research that's accumulated over many decades, hundreds and hundreds of studies that are showing a preponderance of evidence toward the health effects from air pollution. And when we're looking at those health effects, it's good to try to bunch data together. So if studies are similar in the way they measure and so forth, they can use multiple studies. And recent meta-analysis of outdoor air shows, for example, in this particular one, for every 10 microgram increase in the PM 2.5 or soot, that's like an air quality going from 50 to 61. Stroke is up 13%. And disease mortality from heart and from heart attacks is up as well. Another recent meta-analysis looking, and that was for long-term exposure, that's like at least a year. Another recent meta-analysis for short-term exposure showed that if there's a big bump in individual toxins, including PM 2.5 and nitrogen dioxide in less than 5 days, the risk goes up for ischemic stroke onset and stroke mortality. So we're seeing significant stroke health effect. With nitrogen dioxide on the longer end, there aren't as many studies showing a positive effect, but here's an example of a study where in Portugal, Nitrogen dioxide went down due to air cleaning the air over 20 years to 2021. And the years of lost life dropped in percentages proportionally. So this would suggest an association. All these studies are associations. They're not automatic causality. But when you put a lot of studies together and we're seeing the weight of evidence, it's strengthens the connection of the risk. And that's why major organizations are declaring air pollution as a modifiable risk factor for stroke, for example. This is the World Stroke Organization saying that the disability, modifiable risk for disability from stroke is 17% for outdoor and 11% for indoor air. Sorry, it's blurry. How about dementia? Again, outdoor air studies, a recent meta-analysis of 20 studies showed 3% increase in dementia risk for every 1 microgram increment of PM 2.5. That's like 50 to 53 air quality change. And another meta-analysis, now this is for nitrogen dioxide, a jump of 10 micrograms is not equivalent to PM 2.5, but that jump increased roughly the risk by 3%, the hazard ratio by 3%. And larger reviews, here's one from 2021, and I'm sorry again for the blurring, but the red items are positive associations of pollutants with health risk, showing dementia increased for multiple pollutants in multiple studies from earlier years. And that's why the Lancet Commission on Dementia states there's a 45% of dementia is potentially modifiable, and of the percentage of dementia, 3% of from air pollution is modifiable. We're also seeing some studies coming now that are showing evidence for Parkinson's disease. If people are exposed at kind of a moderate level, this is in the green range now, 7 micrograms or 40 air quality, less than 50, actually showed a 56% greater risk of stroke in a large Medicare population compared to people with very low exposure to PM 2.5 on a long-term basis. Well, what about other things? Autism, there's some positive studies and negative studies, so the jury is out on autism, but this study, for example, from 2020 showed that there was an association for a small increment in PM 2.5, a potential risk or an odds ratio increase of risk. There are a number of studies now that can point to risk for pregnancy and childhood air pollution effects on the neurology of infants and exposures of young children. In New Zealand, a recent study showed that preschool exposure was associated with conduct and learning problems and later substance abuse, and high childhood exposures with substance abuse. And in a meta-analysis of 2024, found that prenatal to mid-childhood exposure of significantly larger PM 2.5, that's going up into the 50 to 100 air quality range for longer periods, showed IQ score, significant IQ score decreases. And in a literature review last year, 40 peer reviews showed child brain adverse outcomes, whether structure or functional, associated to air pollution, reviewing many studies. What about adults? Exposure to indoor air pollution. Now we're shifting toward indoor air pollution. Office workers show response times that are slower and reduced accuracy with increased a 10 microgram increase of PM2.5. We saw that kind of a jump before. And in older adults, a 3 microgram, which is like going from 50 to 56, PM2.5 affected memory, attention, and executive function. So air pollution, much of that of our air pollution is understanding of risk. We're taking from outdoor data. I've reviewed a number of neurological associations so far, but there are other associations with other organ systems, including lung, cancer, and maybe even meningiomas in a recent article, birth outcomes, chronic kidney disease, dermatitis, and premature death. And many large groups of studies to show at least some of these are very strongly. So I'm going to now pivot toward indoor air pollution, our major subject tonight. Gas burning building appliances are contributing to air pollution, some indoor air and a lot of outdoor air as well. Gas burning stoves are the primary source of indoor air pollution. Water heaters, furnaces, wall heaters, and so forth are supposed to exhaust outdoors and should be doing that, but may be polluting the indoor space sometimes. Residential indoor air pollution mostly comes from stoves, especially in kitchens that are not well ventilated. So if they're lacking hoods exhausting outdoors, we're adding significantly to our exposure. And the exhaust from all these building appliances becomes outdoor air pollution. But outdoor air pollution actually in most buildings, unless they're very tightly constructed in terms of exchange, outdoor is coming in and adding to the indoor burden. So places that are very polluted outdoors, that's affecting indoor air pollution. And there are primary toxins that are coming from the indoor air situation. And because in the US, in places that use methane, that's the primary source of air pollution, generally, the stoves, because they're not exhausting out directly. They depend on hoods to try to get some of that out. And nitrogen dioxide is the major pollutant, which causes some temporary effects, but also on the long term, as we've been seeing in these other studies for outdoor pollution, long-term effects, especially stroke and dementia, are well documented, and heart disease. Other volatile substances are coming, even if the methane is not burned, benzene, formaldehyde, and so forth, from the stoves, leaking in quantities that may be health significant. And carbon monoxide, if there's enough leaking from other appliances, then we can have like carbon monoxide poisoning, which we all know about as ER visits. But maybe even low levels are causing significant effects, at least for some people, when the methane isn't being smelled or the exhaust isn't being smelled. Particulate matter in the indoor environment is coming from outdoor leakage, and if we're burning foods on the stove are some of the primary sources. If we're creating dust from other activities, that can be added to the particulate matter burden. And we know from our discussion that can be a cause of premature death, as well as the heart, stroke, and dementia, as some of the leading cause neurologic effects. So health harms of gas stoves. Here are some kind of short tidbits. Cooking with a single gas burner without proper ventilation can produce more cancer-causing benzene than a person smoking a cigarette in your kitchen. Baking for 1 hour in a gas oven without proper ventilation can bring your nitrogen dioxide air quality well into the orange, brown, and red levels, not in a fairly rapid amount of time. And hoods are only 25 to 75% effective in getting rid of these exhausts. The elderly, children, and people with chronic medical conditions are at increased health risk. So typical gas stoves and ovens can produce unsafe levels of nitrogen dioxide and benzene that can linger even in distant bedrooms for hours. A Stanford research group has been generating multiple papers in recent years. This is one of them, as well that people living in small homes have 4 times more long-term nitrogen dioxide exposure than those in large homes. And typically these are homes of lower income and environmental justice communities that have other burdens from outdoor air. American Indian, Alaska natives homes have 60% and Black and Hispanic 20% more nitrogen dioxide exposure than the national average. So remember we were saying there were different air quality indexes. There's actually one for nitrogen dioxide, and this is kind of an outdoor air standard, but there are standards for indoor air exposure. It's now a correlation for nitrogen dioxide in parts per billion to air quality index, and the EPA has a 1 hour standard limit of 100 parts per billion exposure, which is equivalent to 100 air quality index. This index is not so linear, so it levels off at higher concentrations. But there is no definite safe lower limit here either. Here's an example of a study where they ran a house, turned the hood on with the gas oven only, and also ran a trial with the hood off. And over the hour of running that oven, here's this 100 for the nitrogen dioxide concentration is like the EPA guideline limit for healthy. Even with the hood on, it was drifting up in less than 15 minutes to above that safe level. And if the hood was off, to 4 times that level. So the health benefits of electrification start to become obvious when we're talking about the health risks. If we completely stop using gas for cooking, additionally, it's important to realize that there's a very strong association with childhood asthma. And if California stopped cooking with gas, it's estimated about 20% less childhood asthma might occur. Frequent stove use doubles children's lifetime benzene cancer risk. That's a recent study. And completely moving to heat pumps for water and space heating would reduce risks. This is also the outdoor air component of premature deaths by up to 85 people in the Bay Area, 110 cases of asthma annually, $900 million in 2023 in health impacts, and countless emergency room visits, lost days of work and school, and other health harms. What about microplastics? I just want to mention this briefly because it's a subject that's significant, and it is a subset potentially of these sort of particulate burden. Even though it's not burned fossil fuels, it is fossil fuels degenerating. And plastics have become a huge part of our lives. Tires are emitting small micro plastics at major roads. Plastic bottles, clothes, and everything in our lives now is being made of plastic practically. And when we use the term microplastics, we're talking about particles less than 5 millimeters, but there are nanoplastics. Remember, those are like 1,000th of a micrometer. They're kind of like the ultrafine particles, so they're much smaller, are also present and can be absorbed through the lung, and we're seeing those in other tissues. Here's a study that came out last year showing that if in prevention of stroke, patients may have an elective surgery where a piece of their carotid artery is removed when it narrows. And they evaluated this tissue, and found that those that contained these micro or nanoplastics had a 12% or 12.5% higher risk of heart attack, stroke, or death. And an article that came out this year was startling, showing that brains, they analyzed two populations of autopsy from various organs, and the brain component, comparing 2024 to 2016, showed larger amounts of micro and nanoplastics, and the patients diagnosed with dementia had accumulated more micro and nanoplastics. Again, this is one study with just some few dozen patients in each of these groups. So more studies are needed to confirm this association, but it is concerning. And the fact is, we are seeing micro and nanoplastics in organs like the brain, the liver, and so forth. So how big are the particles is determining whether we can control those particles in the environment. We can filter out particles, but the best filters that we're using now tend to go down to about 0.3 microns. So that's along the lines of the microplastics, or I'm sorry, the 2.5 particulate matter, and the smaller plastic pieces we've been talking about. Viruses go up to 0.1 microns, but they're typically in the nano range. And nitrogen dioxide is much smaller than that and isn't really captured by filtration. So to keep the indoor air safe, we're trying to keep polluted outdoor air out. And so preferably we're going to close our windows if we're in an area that has significant air pollution. Even if it's still in the green range, it's preferable to keep that down. Filtering with our furnaces, or running just the fan of the furnaces, only filters larger particles, because furnaces don't have the power to blow that air through without damaging the system. They can't handle really strong filtration like HEPA filters. And so these small units that are on the market a lot today, that are up to a few $100s, can have HEPA filters because they're trying to push the air to less volume in one room. So many of us spend about 80% of our time indoors. It's recommended, if you have the access to these air purifiers or filtration systems, that you consider using them in rooms you're in for a lot of the day, like when you're sleeping or working and in the kitchen. When we look at filters, there's something called MERV, that these filters, like this filter in the center, that are on the furnace systems, and those tend to go up to no more than 10 or maybe even 13, but the system can't handle more fine filtration. But you need the HEPA filters, which is sort of like a MERV 17, to get more than 99% of things from 0.3 microns and above. So you can't even really stop all the viruses and the nanoparticles or ultrafine particles with these filtration systems. But you can get significant reductions in soot and small particles. Can filtration systems get rid of nitrogen dioxide? The standard air filters are not effective, even if they have little carbon films, which mainly are trying to get rid of odors. You need systems with many pounds, like 12 pounds of activated carbon. They're very expensive systems to try to get rid of the volatile organic chemicals and the nitrogen dioxide. And those systems aren't realistic for our homes, generally. There was a great review over a week of various recorded topics in the Clean Air Week last month or I'm sorry, now it's September. Yeah, so just over a month ago, and these will be available from when we send out our letter of your attendance. We'll give you the link for all of these slides, and you can use the slides to access the various links and references. So there are recordings of all of these, and they include more detail about air filtration, air quality monitors, and the health effects and so forth, hosted by Electrify now. So we're now moving into the latter portion where we're going to talk about modifying risk. And what can we tell our patients, our families, and our communities? So when we're in the kitchen and we're talking about indoor air, we know that California and many states where methane is the primary fuel for cooking, the risk is primarily from in the indoor air from the stove and the kitchen. And cooking if someone does not have a ventilation to the outside, we are encouraging opening windows unless the air pollution is quite significant, like greater than the yellow range. So one can turn on the fan if it ventilates outside, and we use the back burners if one had to use gas. But what we're really encouraging patients and people to do is use other electric appliances. There are many things now: microwaves, tea kettles, air fryers, pots, and so forth. And if people have the means or the access, going to induction units. The one on this picture shows on the right a small induction unit that you could use instead of gas. The PM 2.5 pollution from the kitchen is coming from not necessarily from gas more than electric cooking. But if someone is sauteing at a high heat, then more PM 2.5 is generated, both by gas and by electric or induction cooking. So the preference is to use lower heat as possible and also use oils with what's called a high smoke point. So some things like avocado, sunflower oils produce less particulate pollution. And it's suggested, if possible, to run a HEPA air filter, which is capturing at least the larger of those PM 2.5 particles. We're also aware that there are communities where, when we talk about environmental justice or vulnerable justice communities that have compounded health risks because of their exposure to multiple other social and environmental risks, factors of determinants of health. And because they may be living, often they can be living next to higher pollution sources like major roads, industry, refineries, and so forth. Racism, lower income, safety, food choices, increased noise, and lack of green spaces, tree cover, just to name a few. Many determinants of health are factoring in here. Often these homes are smaller, as we mentioned, with older appliances lacking ventilation hoods. So they're also getting the outdoor and the indoor mixing and not able to escape those if they can't have access to ventilation and air filtration. So these communities should be prioritized in air pollution reduction and air filtration opportunities and decarbonization policy. In the Bay Area, there have been studies. We have these monitors from the EPA that study large areas, but we know that these populations are in local environments, are getting higher levels of nitrogen dioxide than the monitors, which are trying to cover a much larger area and averaging larger spaces. So in the Bay Area, when they drove cars around and measured more local nitrogen dioxide pollution, They found that people of color were exposed to 55% more nitrogen pollution than mostly white neighborhoods. And children, elders, and people with pre-existing medical conditions in those communities are even of higher risk, of course. In the San Francisco area, these red areas are especially vulnerable. This is from Callan Virus Green, and we know these areas often have people who are in justice communities. And also when we look at the greater Bay Area region, the darker the region, the more exposure. It rings the bay with many communities, and in the Central Valley near the Bay Area. What additionally can we tell our patients besides moderating the kitchen environment? Well, some patients, as we know, are at risk from stroke and from heart attack from exposure to toxic pollution. And those patients might be prioritized for primary, meaning if they have cardiovascular risk factors but haven't had a stroke or heart attack yet, or secondary, if they've already had one of those events, to take added precaution. All of us can take precautions, but especially those in these categories. If there's the opportunity and someone's next to a major roadway, there are studies that show significant risks of increased dementia and stroke proximate to roadways because they're producing more pollution, adding to the burden, that they might even consider moving, and that they shouldn't be in cars and on freeways all the time, like they shouldn't be Uber drivers. And if people have the opportunities to get HEPA filtration units in their home, if they're spending a lot of time there, that those would be also protective. And taking precautions on bad air days. All of these, where there's pollution, at least in the yellow range, would be reasonable to start increasing these interventions. And taking precautions on days with bad air quality, like when there's a wildfire smoke or a red flag day, to avoid heavy exercise, and to consider wearing a K95 mask. There are ones which have these one-way valves so people can breathe more easily, but they're not as protective if they have COVID from spreading, but they are good for keeping the bad air out. Indoor filtration with filtration units. And there even have been DIY, do-it-yourself, air filter guides to create at least some particulate filtration for wildfire, for example, with MERV 13 filters taped to a fan. And there's a link there. So the benefits of reducing fossil fuels are significant. One, we're reducing all of those pollutants in the kitchen and just wiping those clean and not having to worry about them. And we've discussed those in detail. Methane is also leaking from our appliances and from pipes throughout the system, from the source all the way to the home. And that's adding to global warming and the health consequences of global warming. Methane is a 28 to 100 times greater greenhouse gas, and it breaks down to carbon dioxide anyway. So it's a terribly, bad greenhouse effect. And methane gas leaks can cause explosions, right? If there's an earthquake in your home, PG&E had that tragedy of San Bruno in 2010, which leveled 37 houses. So getting rid of methane in the system is a huge health benefit and plus for our communities. How do we go to greener homes and communities? Well, one of the easiest ways actually is just to contact our energy providers, especially if we live in a state, and we're lucky enough to have 10 states which have community choice aggregates where those intervene with the energy providers like PG&E to push up to renewable percentages that are close to 100% or 100% wind and solar, for example. And there are many of these in the Bay Area. But in the country, look at, for example, Rochester, New York. 90% of their mix includes natural gas, nuclear power, and hydroelectric, which are not optimal at all, especially the ones that are spewing direct air pollution. And only 10% may have some wind in it. So in Rochester, New York, they have a community choice aggregate, which claims that they can buy, in a sense, an equal share of what someone uses that is clean, predominantly solar and wind. And this helps build more of the clean energy in the country and in the regions where energy is used over time. In the PG&E breakdown, they claim 23% is renewable, but some of that is what they call biomass, or just burning wood chips, for example, and hydroelectric, which is not really sustainable. So 77% is nuclear power. We'd prefer not to have that either, of course. But if we go to one of these community choice aggregates, there are 5 of them in the Bay Area, then we can get up to 100% just by, signing up. This might cost a few dollars more a month, but it's better, and you don't have to go solar. Solar is not terribly efficient on the individual house basis anymore. Larger renewable energy systems tend to be more efficient. And you can spend that money going to heat pumps, which is going to reduce air pollution directly from your home and improve everyone's health. And if you move down that electrification, doing the kitchen changes, installing heat pumps, and then considering even maybe if one has the ability to go to some electrification if they have to use their car. The Bay Area Air District has been on a pathway in the last couple of years towards phasing out emissions from homes. And the primary emissions from homes, while stoves pollute our indoor air, the major emitters are our heating and our water heater and space heating from homes. And the goal has been to phase out water heaters first in 2027, furnaces in 2029. And that's any ones that break down. It is not all, but moving toward that. And it's a complex process of considering vulnerable communities, which might not be able to do that so easily and would potentially have a high electric burden of cost to make a direct switch. So this is a process that we've been participating along with many other organizations to have a just transition toward electricity. And you can join on December 10th, join us in supporting this. And if you sign up in the chat, there's opportunities to write letters or even attend in person the meeting. There are many resources to help you on your pathway if you're trying to electrify your home. There are still some rebates available, especially prioritizing people of lower income. BayREN the Switch is On, Rewiring America, Quick Carbon, and other services can help you on this pathway. And there are your local energy providers, the energy, including Marin, Ava, and the other community choice aggregates. And if you'd like to participate further, we encourage you to join groups. that are working toward climate, health equity, building electrification, and other health policy. San Francisco-based Physicians for Social Responsibility does multiple levels of this, working on policy, collaboration, education of the public, mentoring of trainees, grants, sponsorship, and research. The Medical Society Consortium of Climate and Health, many of you have heard of, is a national organization that supports clinicians in a process toward declaring that climate and air pollution are health, basically have a health emergency situation, and assisting these organizations in advocacy and education. And the UCSF Center for Climate and Health Equity is also a good resource. If you're interested in joining Physicians for Social Responsibility, has two committees, the Environmental Health Committee that actually is meeting this coming Wednesday, and the Nuclear Weapons Abolition Committee is meeting in December on Thursday, both at 7 p.m. This information is in the event part of our website, which is going to be included in the chat. Just real quick, some of us today are neurologists, and the American Academy of Neurology is our most present and prominent neurology association in the United States, and has a large international footprint. A few years back, Larry Junk, who I think is joining us today, was one of the authors, along with Beth Mallow, of an opinion piece saying, hey, we've got to do something about climate change and air pollution because they have health effects. And that started us on a pathway of organizing together this group of neurology physicians. We presented letters to the American Academy Board, encouraging them to educate, do more research, and advocate. And we met with leadership, and we've been presenting in the annual meetings. Our group is called Niche Brain Health. Brainhealth.com is the link, and niche neurologists interested in climate and health. And we encourage you to join us. We have a contact list at this QR code. So in summary, we've got indoor and outdoor air pollution that are mostly from burning fossil fuels and have profound neurologic and other health risks. Health risk associations are typically higher for PM 2.5, but nitrogen dioxide, especially from stoves, typically has a stronger role in indoor air pollution risk in the United States. More research is needed to understand causality, what interventions best reduce health risk, more details about the role of ultrafine particles and micro and nanoplastics in health risk. And building electrification in the setting of a larger societal electrification with clean energy sources can reduce health risk broadly and also reduce disparities in health risk for vulnerable populations, including elderly, children, and those with increased health risk, and people of color and low income. And we can educate our patients and communities about the health associations of indoor and outdoor air pollution and how to reduce them. And doctors and other healthcare professionals have opportunities to advocate for policy change that reduces air pollution and pursues building electrification.